Have you ever looked at your dog or cat and just sensed something's off? Maybe they're lagging behind on walks, seem a bit shaky, or, just don't have their usual spark.
Yeah, it's that gut feeling owners get.
Exactly. And sometimes the reason isn't obvious. So today we're going deep into something called metabolic myopathies in dogs and cats.
hmm Basically, these are muscle diseases, but they're tied to problems with how the body actually processes energy. Think issues with using sugars like glycogen or fats, or even problems within the mitochondria, the cell's little powerhouses.
Okay, so it's not like a simple strain. It's deeper, like an engine problem.
Precisely. It's about the fundamental metabolic pathways.
Mm.
Now, it's true, the source material we're using from canine and feline metabolic myopathy notes these are, well, still considered poorly characterized in vet med.
Yeah, he's still figuring some things out.
But the information we do have is really crucial. It gives us important insights into these conditions, which, while often rare, can be pretty significant.
So our mission today is kind of like being medical detectives. We want to pull out the key info from our source.
Yep.
Help you understand the basics, what causes them, what signs to look for, and how vets even begin to diagnose them.
That's the plan. So let's start right there. What's actually going wrong inside the body with these myopathies?
Good place to start. What's the core issue?
Well, often it comes down to enzymes, faulty ones. Think of enzymes as like tiny specialized workers in the body doing specific metabolic jobs.
Okay.
And these faults can be inherited, born with a faulty blueprint, basically, or they can be acquired later on.
Uh-huh.
When these enzyme workers don't do their job right, it messes up the whole energy production line. This can cause, well, a couple of main things. Either you get a buildup of stuff because a step is blocked, or the mitochondria themselves, the power plants, get damaged or just don't work correctly.
And which parts of the body feel this energy shortage the most? Where do you see the effects first?
That's a really key question. It makes sense when you think about which systems are the biggest energy users. The heart muscle and skeletal muscles. They're heavily reliant on what's called oxidative metabolism.
Okay, oxidative.
Yeah, it's a very efficient oxygen-based energy system. Think of it as their high-performance fuel system. So they're really sensitive to disruptions there.
High performance needs high quality fuel delivery. Got it. What about other systems?
Well, other systems, like your blood cells, especially red blood cells, and the immune system, they tend to rely more on a different pathway, glycolytic metabolism. It's quicker, less oxygen dependent.
Okay.
And the nervous system is interesting because it actually needs both kinds of energy supply. Plus, we shouldn't forget, sometimes these metabolic problems lead to abnormal byproducts building up in places like the liver or spleen, too.
You mentioned inherited fault, so is it usually genetic, passed down?
The source suggests that while the exact genetic mechanisms aren't always fully mapped out, the fact that many are inherited enzyme problems points strongly towards a genetic basis, like a glitch in the instructions passed down.
Right. Makes sense. And are these glitches common? Do vets see this a lot?
Generally speaking, no. Metabolic myopathies are usually considered quite rare.
Okay.
But there is an exception. Lipid storage myopathies. Those involve problems with how muscles handle fats, and they seem to be diagnosed a bit more often.
Ah, okay. Lipid storage.
Yeah. As for where they pop up geographically, the text suggests probably worldwide given the likely genetic roots.
So rare, but definitely on the radar, especially the lipid ones. Which brings us to, well, who gets affected? Dogs, cats,
Both species. Dogs and cats can both develop these. And this is where it gets interesting. We start seeing patterns linked to specific breeds.
The breed predispositions, always fascinating. What kind of links are we talking about?
Okay, so take muscle phosphofructokinase deficiency, PFK deficiency. It's a key enzyme for using glucose. It's been seen more often in breeds like English Springer Spaniels, American Cocker Spaniels, even Whippets. Sort of suggests a link, maybe, between their high-energy needs and finding this problem.
Interesting connection.
Then there's acid maltase deficiency, noted in Lapland dogs.
Yeah.
And branching enzyme deficiency, that's another issue with storing glycogen that's been found in Norwegian forest cats.
Wow. Okay. Specific enzyme, specific breed, any others?
Yep. Debranching enzyme deficiency, related to glycogen again, seen in German Shepherds, Akitas, curly-coated retrievers. Then there's pyruvate dehydrogenase phosphatase 1 deficiency, different energy step, links to Clumber and Sussex Spaniels.
Huh.
And finally, mitochondrial myopathy problems with the powerhouses themselves observed in Old English sheepdogs, Yorkies, and the source specifically says possibly Jack Russell Terriers.
Possibly. So they're still looking into that one.
Seems like it. Yeah, that possibly suggests it's not fully confirmed or maybe less common. But look at the range of breeds. It really shows these aren't just isolated issues, but affect quite a few different genetic lines.
That's quite a list. Really drives home the genetic angle. So when do these problems usually show up? Are we talking puppies and kittens or older animals?
The age of onset is a pretty big clue.
Mm-hmm.
For the inherited types, the signs often appear quite early, maybe around 2 to 3 months old.
Okay, young.
But the acquired forms, the ones that develop later, they tend to show up in adult pets. And interestingly, the source didn't find any particular sex bias. Males and females seem equally affected.
So young animals, maybe certain breeds showing signs. Let's talk about those signs. What would an owner actually see?
Right, and it's important to remember, like we said, diagnosis can be tricky because these aren't always straightforward. But key things owners might notice are, well, general muscle weakness. Maybe their pet tires out way too easily. That's exercise intolerance,
Mm-hmm.
muscle cramping, sometimes even sudden collapse episodes.
Okay, collapse is definitely scary. Anything else on the owner's checklist?
Yeah, sometimes they might report regurgitation, like spitting up undigested food, or maybe difficulty swallowing dysphagia. That could point to issues with the throat or esophagus muscles. Dark urine is another big red flag. It might mean muscle proteins are spilling into the urine, like myoglobinuria.
Right, serious sign.
And in some cases, you might see neurological signs, confusion, disorientation, what's called encephalopathy, or even vomiting.
And when that pet gets to the vet, what might the vet pick up on during the exam?
Well, the vet might be able to trigger or observe that exercise-related weakness or stiffness, maybe even cramping. The neurological exam could show issues like disorientation, maybe stupor, or, worst case, coma.
Okay.
If those byproducts are building up in the liver, the vet might feel an enlarged abdomen on palpation. But here's a really tricky part of that. The animal might seem totally normal between episodes.
So the signs can come and go.
Exactly, fluctuating signs. That makes catching it in the act, so to speak, really challenging.
Yeah, I can see how that would complicate things, especially if triggers are involved, like exercise. Okay, so we've got the what and the who. Let's circle back to the why. What are the main drivers behind these conditions?
So like we touched on, the big one is often an inborn error of metabolism, that genetic defect from birth.
Right.
But they can also stem from acquired issues later in life, maybe triggered by viral infections, certain drugs, or possibly environmental factors, though those seem less common causes, according to the source.
And risk factors. What makes a pet more likely to get one?
The number one known risk factor is inheriting the faulty gene, which, as we saw, often links back to specific breeds.
Makes sense.
But the text also points out there are likely other risk factors that we just don't understand yet. So, still some unknowns there.
Still pieces missing. Okay, so let's say a vet suspects a metabolic myopathy. How do they actually figure it out? What's the diagnostic path look like?
It's usually a multi-step process. First, they have to rule out other things that could look similar. That's the differential diagnosis.
Like what?
Things like inflammatory muscle diseases, other kinds of non-inflammatory muscle weakness, even other metabolic problems causing brain issues. And honestly, a muscle biopsy is often really crucial to tell these different categories apart.
Okay, biopsy is key. What about regular blood work and urine tests? Do they help?
Oh, absolutely. Your standard CBC, biochemistry panel, urinalysis, they can provide really valuable clues.
How so?
Well, for instance, levels of lactate and pyruvate in the blood, these are energy metabolites. They might shoot up after exercise or even be high at rest if the animal has trouble with fat metabolism or the oxygen-using pathways. But interestingly, with problems specifically in glucose pathways, those markers might not go up, so that difference can be informative.
Okay. Subtle clues.
Yeah. And creatine kinase, or CK, that enzyme leaks out of damaged muscle. It might be high after exercise or just persistently elevated. You might also see low blood sugar hypoglycemia with some types. And high ammonia levels could point towards related metabolic issues like urea cycle defect.
So patterns in those routine tests can definitely raise the alarm. Are there more specialized tests available?
Yes, several. They can measure specific amino acids in the blood or organic acids in the urine to look for those abnormal metabolic byproducts we talked about.
Okay.
Measuring carnitine levels in blood, urine, even muscle tissue is important if they suspect a fat metabolism problem, like those lipid storage myopathies.
Right, carnitine for fat.
Exactly. Then there are specific enzyme assays where they can directly test the activity of a suspected faulty enzyme. Sometimes they might even culture skin cells, fibroblasts in the lab to study the defect on a cellular level.
Wow.
And of course, if the specific gene mutation is known for a condition, DNA testing can identify affected animals or carriers.
Sounds incredibly thorough, from blood chemistry right down to the DNA. What about imaging, like X-rays or ultrasounds?
Well, the source specifically mentions MRI magnetic resonance imaging. It gives really detailed pictures of soft tissues.
Okay, MRI.
It's particularly useful for looking at the brain and spinal cord. In human medicine, MRIs often show changes in the central nervous system with these conditions, and it's likely similar findings could occur in pets.
Okay. And beyond biopsies, are there other sort of invasive tests?
Muscle biopsies are definitely central, but depending on the case, other things might be needed. Since the heart muscle uses similar energy systems, a full cardiac workup, maybe an echocardiogram could be important.
Makes sense. Check the heart.
Yeah, and if the vet feels organ enlargement, like the liver or spleen seems big, biopsies of those organs might be necessary too.
And when they get these tissue samples, like the muscle biopsy, what are they actually seeing under the microscope that screams metabolic myopathy?
The microscopic view can be really revealing. For example, if they see lots of tiny fat droplets inside the muscle fibers, that strongly points towards a lipid storage myopathy.
Okay, fat droplets.
A classic finding in mitochondrial problems is something called ragged red fibers. They have very distinct, blotchy red appearance with certain stains.
Ragged red fibers. Got it.
And if there's an abnormal buildup of glycogen granules, that signals a glycogen storage disorder. These visual clues at the cellular level are often critical for nailing down the specific diagnosis.
Amazing what they can tell from looking so closely. Okay, so you've got a diagnosis. What happens next? How are these conditions treated or managed?
Right, the approach really varies. If the pet is really sick, maybe having seizures or severe metabolic issues, they'll likely need to be hospitalized for intensive care.
Okay, inpatient.
But if the signs are mainly muscle-related and less severe, management might happen on an outpatient basis at home. Nursing care needs to be tailored to whatever problems the pet has.
And what about lifestyle things, like exercise?
Activity restriction is often needed, especially if exercise clearly makes things worse. Diet is also usually a big piece of the puzzle.
How so?
Often, avoiding prolonged fasting is important because the body might struggle to mobilize energy stores. Depending on the specific defect, there might be other dietary tweaks needed, like limiting certain fats or carbohydrates. Sometimes, specific vitamin or cofactor supplements might help support the struggling metabolic pathways.
Right, tailored nutrition.
Exactly. It all depends on the specific enzyme or pathway that's broken.
Are there actual medications that can help?
For some types, yes. The source specifically mentions treatments for lipid storage myopathies, things like L-carnitine, riboflavin, which is vitamin B2, and coenzyme Q10. It even gives potential dosage guidelines.
Okay, so targeted supplements.
Yeah, supportive therapies. And it notes that mitochondrial myopathies might also benefit from similar treatments, though maybe less predictably.
And what's crucial for owners to understand?
A really key point is client education. Owners need to understand that most inherited defects aren't curable in the traditional sense.
Right, manageable, not curable.
But some, especially those lipid storage ones, can often be managed effectively with the right treatment plan. And, critically, owners of affected animals should be strongly advised against breeding them to avoid passing the faulty genes along.
That responsible breeding message is so vital. Are there general precautions owners should always take?
Yeah, generally avoiding those triggers like prolonged fasting or really strenuous exercise if they're known to cause problems for that individual pet.
Okay.
And for conditions like lipid storage myopathies where treatment is possible, monitoring is key. Looking for improvement. Is their strength returning? Is muscle pain reducing? Are those CK levels in the blood coming back down to normal?
Makes sense. Track the progress.
So looking long term, what's the outlook? What are potential complications?
A major potential complication, especially if the brain is involved, can be severe, lasting neurological impairment.
Okay, that's serious.
As for the overall prognosis, it really hinges on the specific disorder. Sadly, for conditions where we don't have effective treatments yet, the prognosis is often poor.
But for things like the lipid storage myopathies, the outlook can actually be pretty good if there isn't some other underlying metabolic issue complicating things. So it's quite variable.
A real spectrum of outcomes, then. Okay, let's try and wrap this up. What are the most important things you want people listening to take away from our deep dive today?
I think the main things are metabolic myopathies are this complex group of conditions all related to energy problems in the body.
Right. Energy production gone wrong.
Exactly.
Yeah.
The signs can be really varied, from just seeming a bit weak to having major neurological crises. Diagnosis isn't always easy and often needs specialized tests, like biopsies.
Uh-huh.
And maybe the most important thing for owners is recognizing those early, sometimes subtle signs and getting their vet involved for a thorough workup. That early investigation can make a big difference.
So hopefully you listening now have a clearer picture of these rare but significant conditions. Maybe this knowledge could even help you spot something important in your own pet someday.
Yeah, and thinking about all this, especially the genetic links, it raises a fascinating question for the future, doesn't it?
How so?
Well, with genetic testing getting better and cheaper all the time, what might that mean for detecting these conditions earlier in at-risk breeds? Could we even develop preventative strategies down the line based on genetic profiles?
Proactive genetic management. That's a really interesting thought. Where could this all lead?
It's definitely something to watch in veterinary medicine.
Absolutely. And of course, the essential reminder, if any of the signs we talked about today sound familiar, if you're seeing something worrying in your own pet, please have that conversation with your veterinarian.
Definitely the crucial next step.
Oh, thanks for joining us for this deep dive.